I'm Dr. Byers. I'm the hospitalist director and also recently have been appointed to the medical leadership of Ivinson Hospital's COVID-19 response. So testing's a hot topic in most of the nation at this point in time. Ivinson Hospital is following the CDC recommendations for testing. And basically what that is that young and healthy people do not require a test. They will be instructed to quarantine at home if they're symptomatic. We are testing patients at high risk with other medical conditions, and it's also limited to healthcare providers. So as the CDC updates and changes their recommendations, that's what we will continue to follow. They should call the hospital's hotline for the COVID response. There, a nurse will screen you with questions. If you are young and healthy, you will be told to quarantine in place. If you have other medical conditions or your illness is more severe, the nurse there will direct you to the appropriate location, whether that be the emergency room or our outpatient clinics. Well, the best thing you could do is just not get sick and limit your exposure in the community. At Ivinson Hospital, we agree and support the recommendations made by state and local governments regarding social distancing, staying at home as much as you can, and just being smart about how you're exposing yourself in the community. I know that people have to get supplies, groceries, medications, and things, but you need to really be smart about how often you're going out. My family personally, we used to just pick up what we needed for the day, and now we're trying to pick up for roughly about a week, depending on what my schedule is. When I go to the store, when I go to Walmart, I go by myself. I don't take my entire family because the risk to one individual is significantly less than the risk to many individuals. And when I go, I maintain my distance as much as I can without being impolite. And I touch as little things as I can. When I get back out to the car, I use my hand sanitizer and then just go about my day and go home. Well, it can be boring, I know, to stay at home and not be able to do the things you want to do. Luckily, we have technology, and it's a good time to reach out to people that you otherwise might not have the time to do. And also, this is a time to better yourself. In the military, where I spent much of my time before coming to Wyoming, we would use this perpetual boredom to improve ourselves. So whether that be mentally, physically, spiritually, or all of the above. So now would be the perfect time to get up, go for a walk, get yourself in shape, read a book. Like every other hospital in the country and the world, we're preparing. As you've all seen in the news, supplies are limited, but we've been able to find new and creative ways to get things. Our medical floor and our ICU are taking the necessary steps to be able to support as many people as we can. But again, I want to reemphasize that what you can do to help us or any hospital in the country is to not get sick.